Okay, so I'm going to talk to you about back pain and the impact that poor posture can have on back pain. So I've got some objectives I'd like to meet by the end of this presentation. I'd like for you to be able to describe the impact that back pain can have on a person on their everyday life. Be able to identify some causes of back pain and some risk factors for developing back pain. Identify the characteristics of what makes up a good posture. Recognize poor posture and help to identify the causes of that. Understand the relationship between poor posture and back pain, and demonstrate proper body mechanics and ergonomics at home. So, how common is back pain? It accounts for 264 million lost work days yearly. That's enough for 2 per worker. It is the single most common cause of disability worldwide. Americans account for $50 billion worth of healthcare costs from back pain each year. Experts estimate that 80% of people will have back pain at some point in their life. It's very highly correlated with depression. A study has shown that when examining those with chronic back pain, up to 74% of people who have chronic back pain will have been affected by depression at some point. A separate study showed that having depression makes the likelihood of increased back pain more likely, even if that depression is a result of the back pain. So recognizing back pain and identifying these characteristics. It can present in many different ways. It could be burning, it could be stabbing, tingling, numbness. It can go from the back down into the hip or into the leg. Many different ways. It's common for it to be worse with bending or twisting. Your physical therapist can perform a lot of different tests to help to try and determine the cause of this back pain. Straight leg raise is probably the most common, but there's a lot of others. However, medical imaging from a physician is the most accurate way of diagnosing the cause of back pain. Some of the most common causes of back pain include strain to muscles or ligaments, bulging discs, osteoporosis, arthritis. There are many others, but those are the most common. And some of the risk factors for developing back pain include weight gain or obesity, physical inactivity, age, job-related factors, mental health abnormalities, smoking, among others. Studies show that physical therapy helps to reduce back pain. Obviously, the type of physical therapy depends on the therapist involved, but the McKenzie approach is the most common. Involves repeated movements to determine directional preference in order to centralize peripheral symptoms. Other approaches include traction, joint mobilization, soft tissue massage, strengthening. There's several different types. Characteristics of proper posture involve muscles around the joint being in balance. When these muscles are in balance, there is no excess strain being put on these muscles as a result of that postural abnormality. In order to assess posture, the most common method used, at least in this field, is a plumb line assessment. So that involves taking a picture of someone in an anatomic position, and afterwards drawing a line down the middle of their body where the spine would be, separating them into equal left and right halves. Same thing is done from the side, and that line has a little more landmarks that it has to pass through, including the lobe of the ear, the acromion process, 7 cervical vertebrae, anterior to the midline of the knee, and anterior to the outside of the ankle. But using that line, you search for asymmetries from one side to the other, and you check for the alignment relative to other structures. So you can look at the alignment of the head, you can look at the curve of the spine, symmetry between shoulders, hips, knees, pelvis. The next picture shows a postural analysis using a blood line. This first picture shows the view from the side and all the landmarks it has to pass through. The second one shows the comparisons and asymmetries that could be seen from the frontal view. So an abnormality in posture is when these structures are out of balance. This places abnormal strain on the musculoskeletal system. Can result in an increase in joint load, it results in pain commonly. Muscles that are prone to tightness with postural abnormality are often activated in movements that do not normally cause them to activate. This can lead to a lot of the pain symptoms that you see with abnormal posture. So a lot of different types of posture abnormalities exist. There's forward head, there's rounded shoulders, anterior pelvic tilt, posterior pelvic tilt. The ones that I will be focusing on are the upper and lower cross syndromes, and that's just because they're extremely common and they're relatively easy to address. So upper and lower cross syndrome are where there is a series of tight muscles on one side of the body and weak muscles on the other. So upper cross syndrome consists of tight suboccipitals and tight pecs, and weak neck flexors and weak rhomboids and lower traps. So it forms a cross pattern. That's where the cross syndrome comes from. This typically affects the neck and the upper back more than the lower back, but when you lose range of motion in one joint, you've got to make it up somewhere else. So that's why we're covering it here. So the lower cross syndrome is a similar idea as the upper cross. It involves tight hip flexors and tight lumbar paraspinals and weak glutes and weak abs. So to address this, you strengthen the weak and stretch the tight. So how does posture relate to back pain? A lot of research shows that the two are related, especially when these poor postures are a part of your daily routine, whether it be at work or at home. The repetitive micro trauma that causes leads to these postural abnormalities and can lead to pain. McKenzie stated that low back pain from prolonged overstretching of the innervated soft tissues is a result of maintained poor sitting and standing postures. So McKenzie is the leading back therapist in this field. So these, like we talked about before, the muscles that tend to shorten are overactive in an abnormal fashion in movements that they're not normally active in. This can lead to pain, which leads to fatigue and instability, which in turn leads to more activation, which causes a cycle of more pain and fatigue and instability. So addressing these dysfunctions is important. So what do? You, like I said before, you strengthen the weak, you stretch the tight. Here's a list of the weak structures, includes the glutes, the abs, the deep neck flexors, the scapular muscles, rhomboids, and lower traps. Tight is the hip flexors, the paraspinals, the pecs, and the suboccipitals. In your handout is an exercise program which provides an entry point into addressing these concerns. So it's not, by no means is it all encompassing, but it provides an entry point if this were something that were of interest to you. So the picture on the next slide, the lady picking something up out of her car. I'm assuming that the three of you have to get in a position similar to that when working with patients at some point in the day. The first picture on the left, where she is bent over, her knees are straight, all of the strain is put on those stabilizer muscles in her low back. The one on the right, she's able to sit her hips back, keep her back straight, and the stress, rather than put on the stabilizer muscles in the back, it's on the big muscles of the posterior chain, which are built to take that stress. Obviously, this is not a comfortable position to maintain for a long time, and a more simple solution would be to raise the seat height or pull up a chair, but if that's not an option, then this provides a more friendly method for your back. So ergonomics when sitting at a desk, which is another part of all three of your lives because you have to document after you work with a patient. Plays into low back, especially when you are not able to maintain that lumbar lordosis, that curve in the low back. So a chair with proper lumbar support is key. Other factors include you want the desk to be 25 to 30 inches from the floor, monitor to be 18 to 24 inches from your face, just below eye level for the monitor. You want the elbows, hips, knees, and ankles to be 90 degrees. Feet flat on the floor and the elbows supported without having to shrug the shoulders to stay comfortable. So in conclusion, back pain is very common. It's a big deal. It affects people psychologically, socially, economically, a lot of different factors. It's a big deal. Poor posture creates that strain on those structures around the joint that can lead to these symptoms over time if not addressed. Poor postures when taking place at work or at home over a period of years takes a real toll on the body over time. And exercise and physical therapy, being mindful about your body mechanics and ergonomics can have a great effect at reducing back pain.